enter the room.
Hello, good morning. I'm Dr. Sana Zainab, GMC number 8106257. May I proceed?
Yes, please proceed.
Hello, you must be Griffith.
I am.
Hi, you must be Griffith.
Yes, I am.
Oh, I'm Dr. Sana Zainab. You must have seen me in the round in this unit, right?
Oh, I've seen you severally. I know you very well.
Yeah, how are you, Griffith?
I've seen you severally. I know you very well. Okay.
How are you, Griffith?
I'm doing well. I'm fine. I'm fine. Very fine.
That's good. Griffith, you must be wondering why I have called you in the room over here.
I was told you want to talk to me.
Yeah,
So that's
there's
why.
nothing to worry about, Griffith. It's just that from time to time we like call our colleagues so that we can like the junior ones so that we can have a chit chat with them and see if that everything is right with them and they are doing good in the wards. All right?
I have no problem. I'm doing very good.
No, great. I'm so happy to hear about it. So how is your rotation going on?
It's been going on well.
Oh, all right. Any issues you have faced still now?
I'm not feeling any issues. Did anyone tell you I'm facing any issues?
No, nobody told me anything. I just want to have a check on our juniors so that we can make them feel good and ask if they have any issues, because as seniors, it is our duty to like keep a check on everyone. So like, have you been able to make any new friends in the department?
Yeah. Yeah. Make a couple of friends.
Oh, that's very good. And apart from that, what are your hobbies after that? I understand there is a very hectic schedule at the hospital. So what do you do after at home or to relax?
I play chess out when I get home.
What?
I play chess.
Okay, all right. And apart from that, Griffith, where were you last night?
I just hung out with some friends and that
Oh,
was
that's
it.
very good. Okay, what sort of hangout?
It was with my girlfriend and I just recently separated from her, and so if I took some drinks, that was all.
All right. So the guys had been drinking last night, right?
Yeah. I just
Mm-hmm.
have just about 3 bottles of vodka. That was just all.
Okay, all right, Griffith. So since morning, have you seen any patients?
No, I'm fine.
Uh,
I'm fine.
have you seen any patients since morning?
No, I've not seen any patient this morning. Just I've just been on the computer going through the cases.
Oh, all
Not
right.
much.
On any chance, have you like did any procedures on any patient?
No, I've not done anyone.
Okay, all right. And how do you feel about yourself? Do you feel that you are not able to concentrate, or you feel fine?
I'm fine. I'm fine. Fine. Very fine. I don't feel dizzy. Nothing. Are you asking about just because of the 3 bottles of vodka I took that I told you?
So actually, Griffith, like I'm concerned about this thing because it's not just about today. I guessed it because you were smelling of alcohol, all right, and that was quite noticeable. And I think if I have noticed it, then might be other staff has also noticed this thing about you. So that's why I just called you here so that I can have a discussion before anybody else notices and raises some concerns about it. It's just for your betterment.
So is that what they do in the department? Just be gossiping people about one thing or the other. That's my private life. I drink alcohol and what?
I understand completely, Griffith, that like this is your private life and you have all the right to enjoy all also because we have a hectic life at the hospital and we can enjoy. But I think there are several other options for enjoyment. You can like go out for a walk, go out for some dinners or anything. I'm telling you this thing because Griffith, as a medical professional, we have a very big duty we have to serve the patients, and that mainly involves so much of our decision making abilities, and also we are like dealing the lives of the people, and we cannot afford to make any mistake, and we cannot afford to risk the life of any of our patient. Are you understanding, Griffith?
I see where you're coming from.
Yeah,
Yeah,
Griffith.
I do.
I'm just trying to tell you these things because as a senior, this is my duty to guide you because you are a junior over here and you might not know of many things, and this is not your fault when the person is a junior and they have been
2 minutes remaining.
they are new on the duties. They may not know of everything and the complications, consequences and complications of the things. So that's why I'm just explaining these things to you. Also, because when a person is under the influence of alcohol, their decision-making power is greatly affected, right? You might know about,
Are
must
they
know
going to
about
sack me now? Are
what?
they going to sack me from work now?
Griffith, it is like that. As you were also smelling of alcohol, and this is not only about today. It was like 2 days before. I also noticed this thing, but I tried to ignore it so that uh, like a first time things, but today this has again happened. So this also puts a bad reputation on our a bad
Mm,
impression on our reputation because we are doctors and everyone believes us to be professionally good and composed. All right.
mm, I see.
Yeah, Griffith, you seem convinced. I'm not here to scold you or say anything to you, but this was my concern because we cannot afford any risk to the patient. And especially, Griffith, it is not like you are not allowed to drink. You can drink, but you may drink on the weekends, all right? Not on the weekdays when you have a duty, only the next day that you drink at night and come on the duty at next day. Because in this way, you might be under the influence of alcohol, and the patients you will be looking after, their care might be affected due to this. All right.
Mm, yeah, I
I'm very
see.
glad that you understood this thing. So, Griffith, I believe that you must not have taken any thing to the heart, and you have understood what I'm saying.
Yes, I do.
And Griffith,
I
if you
do.
face anything in the world, you can come and tell to me. All right, I'm here to help you as your.
Move on to the next station.
All right.
All right, guys, thank you so much for that. Good job. Thank you so much, Dr. John, for the simulation, and Dr. Sana.
Thank you.
Yeah, you're a very kind Dr. Sana. But yes, let's understand the issue over here. Like, what would your next steps be once you identified that there is a junior or a colleague who has come to the ward under the influence of alcohol? What is the next step that you ought to be doing?
I should be looking after the patients which he has seen in the morning so that I can see if anything is missed and if any mistakes are made in their care.
So yes, and
And I think I should have only warned him at this stage. I didn't think of escalating this thing because
should you
patient
be
care was not affected.
but would you be escalating it?
Um, should I?
So you're saying that the patient care wasn't affected, but
Yeah,
you.
that's why I didn't escalate it.
All right, yeah, that's one way of looking at it, but that's not your call to make, doctor. So you don't know if the patient care is affected. The only knowledge of whether the patient care has been affected or not is only coming from the conversation you had with the patient, with the doctor himself. Right? Did you talk to the patient to understand if the patient care was affected? Did you go check on and anything? It happened 2 days back. Do you know anything that has happened? Has anybody else smelled alcohol on him? What if a patient has smelled alcohol on him and he's gotten that impression that this doctor has come under the influence? So he's
Mm.
gone spreading that. So at this point, you don't know the consequence of that action. So you can't take it upon yourself to, what you say, make the verdict, or, pass the verdict, or whether or not, what to do with this person. It's not your call, quite frankly. So your job as a fellow doctor, if you identify that any patient is at risk, and that is a potential risk, doctors coming under the influence of alcohol, that poses a big risk to patient care, right? Right. So this is something that is affecting patient safety. For you, the utmost thing is to prevent any harm to your patients. That's the whole basis of the ethics, the malevolence, the non-malicious act, right, of not causing harm, right? So you can't give him that opportunity to, to cause harm again. And if you have identified that this is something, that this is a potential, person that can be causing harm to your patients, you have to report it, right? Because more than, building trust with the doctor, you actually have to make sure your patients are not at risk. So your job is to confront him, because that is the first time you identified it. So always, whenever you're going to be escalating something, you have to make sure to confront the person themselves and ask them to escalate it, right? Because this has happened, right? This is not something that has not happened. This has happened. So you want him to escalate it. You want the, the consultant to know, because from here, whatever happens is the consultant's job. All the decision making is on the consultant, right? So you can't make that decision on what is going to happen next to him, because right now he's technically under the influence. You can kind of smell alcohol from his breath, so you can't keep him in the ward anymore. You have to ask him to leave. So what are you going to reply to the consultant saying that why did you ask him to leave? You can't cover for them. You have to give them the reason for why they were asked to leave, right? Any other responsibilities of whoever the patients he has seen, that should be properly allocated within the department by the consultant. Then you're just taking on more responsibilities. Do you know what I mean?
Yeah.
Right. And also, by actually, you have to maintain a kind of professional standard and integrity, right? And if you actually see that somebody is in breach of that, you have to report that, because that's what you're trying to uphold, right? That the patients maintain their trust in the professionalism that you are trying to showcase. I mean, that's exactly why they come to you in that sort of a vulnerable state, so that you don't take advantage of that. Right. So if you have identified that there is some wrongdoing that is happening, you are required to report, not cover it up. Because again, that will have its own consequences. It's not your job on what is going to happen next to this person. Yeah, it's the consultant's call, not yours at all. Right. So if you see that there has something, if you have seen that there is a breach in medical ethics within the practice, you ought to be, mentioning it to your seniors. But before you actually escalate it from your end, you should, you should actually talk to them and tell them to escalate it. Tell them to report it, so that they take responsibility for their actions. That is the opportunity you're giving them. That I have noticed this, and this is the second time that I've noticed this, and this is not the first time that coming under the influence of alcohol, it poses a big risk to the patient safety. So I'm going to be requesting you to report it to the to our consultant. Right. So now, if he goes into acts where he says, where Dr. John very well actually mentioned that now you're getting into people's personal life and gossiping about it. Right. How would you deal with that question?
I was just understanding half of the things of Dr. John and half I was not understanding. Maybe there was some issue with the internet as well. I think he was also not able to listen me sometimes.
Yeah, I'm really sorry about that. But yeah, if you happen to tell me something like, we have smelled alcohol, and I've also gotten some information from the ward that they smelled alcohol on you, and if I turn around and tell you it's not your business, it's my personal life, stay out of my personal life, then what are you going to answer? That may happen. That is something that gets. So how are you going to answer that?
So I will be like that. I'm your senior, and like as a senior, it is my duty to like tell you what is right, what is wrong, and how to do these things. And I know it's not your fault because you are a newbie, and sometimes we do not know the things when we are new.
Well, not really, quite frankly, because you're not coming to him in the form of senior. You're just, you are coming to him saying that, you are a potential risk to our patients. And as a fellow colleague, I cannot just stand by and watch, right? As a doctor, we uphold high standards of integrity and maintain professionalism, and you're at the moment you're in breach of that, right? And it is responsibility to make sure that there is no harm that has come to our patients, because of this alcohol influence that you are under right now. Right. So it's not like you're going into the person, because quite frankly, his personal life did spill into his professional life, and you are in a professional setting experiencing that. Right. So, you can't be like, it's not your fault. It is his fault. He can't be seen in the hospital under the influence of alcohol, quite frankly, or any other, illegal drugs. Because that is actually, because that is literally in breach of what you stand for. Patients come to you in a very vulnerable position. You can't abuse that role, right, and cause them any risk. Then patients will never come back to you. Like, why would they ever come back to a doctor, having that impression that doctors nicely, have fun and come to work under the influence of alcohol and other illegal drugs, right? So, you just have to mention the ethical aspects to it. You are actually in breach of certain ethical standards. And unfortunately, this is not something that I can just stand by, right? Since I have noticed this, I am going to raise it, and I'm giving you the opportunity to raise it from your end. Yeah. So what does everybody else think about this case? Anybody has to add anything to, the discussion that's going on? Anyone, any comments? Yeah? All right, that's all right. Let's quickly look at the performance. Dr. Ranmali, did you get an opportunity to mark? Awesome. Thank you so much. All right, so let's take a look. Okay, this is okay. Okay. So identify confirm the identifiers, Griffith Hammerman's full name, the role in the surgical unit. You started with a lot of small talk. You were trying to tiptoe around the fact that you noticed him under the influence. You were like, I'm just here to talk to you as a senior. No, you technically you're not. You're actually talking to him about his behavior. Certain concerns that you want to raise and you want to bring to his notice, quite frankly. So be very frank about that fact. So you can start with a few small talks in the beginning. How is your rotation going? How are you feeling? How are you adjusting to the ward and all that? And then like, so the reason why I have called you in today, be very frank about the reason why you've called you in. I've noticed that I've noticed that you're smelling of alcohol, and this was not the first time I've noticed this, right? So would you want to explain a little bit about why this has happened? Give him the opportunity to explain himself, right? And then if they come on offensive to you, saying that it's none of your business and all, you can always mention the ethical, taking the ethical standpoint, right? Otherwise, go on to a simple conversation. They may actually become offensive, saying that it's not your responsibility, and or else they may actually be like, "Oh, doctor, you don't understand. I've recently had a bad breakup with my girlfriend and all that." They may go in either ways. So if you actually notice that if they're going in either way, like, yeah, I understand this might be difficult for you to cope, but unfortunately, this is not a behavior that can be condoned within our practice, right? Kind of why, also you explain why, according to the medical ethics, we can't be endangering our patients, especially having a doctor who is under the influence of alcohol. We can't be, tending to any patients because of this, right? So you're asking. So yeah, this is a very uncomfortable conversation, and a lot of people shy away from it. But these are the conversations you ought to be making, right? So definitely don't tiptoe around the fact why you have called him in, because this is a conversation you ought to be having with him. So one of the questions might come up where he goes like, "Are you going to inform the consultant?" So what will you answer to that?
That if I should tell the consultant.
Yeah.
So I will say that like as patient safety is our concern, and this we cannot endanger it, and so that's why we need to inform the consultant so that he can look into this and then take any action if he needed.
Absolutely. Yes. Yeah, informing the consultant is a necessity over here, and I'm going to give you, and I'm going to ask you to do that. So, rather than tattling or rather than informing on your own, you ask him to inform the consultant. So if you ask him to inform the consultant, again, there might be a little bit of a pushback where they go like, no, I don't want to inform the consultant, I'm scared and all. I mean, you can say that, there is support available to help you out during this tough time. He would have a better idea on, how to handle this. He will need to make certain decisions where, he will be sent home today, right? What is going to happen? You can kind of tell him that you can be sent home today. He can get in touch with your educational supervisor, who would actually give you the resources to seek help in this condition of yours, right? Because that's what ought to be done. Because you, instead of actually covering for the patient, you're covering for this person, you're actually trying to offer them help to cope with the situation they are in, right? So that way he also gets help, and nobody kind of suffers from the influence that he is in. All right, let's take a look quickly. Understand the personal and professional impact of alcohol use, include patient safety concerns, right? This is very important. Like, why are you doing what you're doing? Because at this point you are at risk of patient safety, and that's something that you just cannot stand by at this point. Confirm the reason for the meeting and Griffith's understanding of the situation, right? Inquire about the frequency, amount, and duration of alcohol consumption, right? Just to understand, is this like a one-time thing, or is it like a habit that he's fallen into? Explore the emotional impacts of the recent breakup and its influence on alcohol use. Yeah, that's the trigger, basically. Yeah. Ask about any previous history of alcohol or substance abuse, right? So at this point, you are understanding the fact that this person has been using alcohol, and this might be a habitual thing, right? So you want to bring that out of him, in the data gathering, basically. Management. Explain the risk of alcohol affecting clinical judgment and patient safety. So this is your main thing, right? So because of that, all the steps that you're going to take is in accordance with this particular point, right? Offer support to seeking help, like counseling, GP consultation, alcohol cessation clinics. These are the further help you can actually give to this person. Discuss the necessity of informing the senior staff member for patient safety and compliance with GMC guidelines. Encourage Griffith to take the day off and discuss plans to cover his duties. You have a professional duty to inform your educational supervisor or clinical supervisor immediately. Your educational supervisor can help you access support services like occupational health or practitioner health program. If the doctor has seen any patients or done any procedures, I'll give you a mark for this one. Make sure that the patient and the procedure, the work he has. Sorry, if the doctor has seen any of the patients, make sure to. Okay, so this will be make sure to reassess the patient and the procedure and the work that he has done. Right. I'll just change that point. All right, and develop a plan for ongoing support, regular check-ins, and counseling sessions. Yeah, and reassure Griffith that the situation will be handled with confidentiality, involving only those necessary to provide help. Right, interpersonal skills. show understanding and compassion for Griffith's situation, offer reassurance and encouragement, reinforcing positive steps towards recovery, signpost, explain the structure of the meeting and the steps you will take, use empathetic and non-judgmental language throughout the conversation, listen attentively to Griffith's concerns and feelings, acknowledge his efforts to cope and the willingness to seek help. All right, so I hope that that clears it. So anybody, any doubts, any questions regarding this this case? Anybody wants to add a few things? Yeah. No?
When I said
Yeah.
Colleagues are gossiping me, I don't know how she should have responded.
I mean, that's not something. Yeah, thank you so much, Dr. John, for that question.
Hello.
So your question was, are the colleagues gossiping about me, right? So let's look at the question for that.
Exactly,
so,
yes.
So at this point, who is the person who noticed? The candidate themselves, the person who's talking to you is the one who noticed, right? So if you actually say that, are you gossiping about me? You can always come forward with the fact saying that this is something that I noticed. And if it is something that, if the nurses, in certain cases, there might be some nurses who might have come and complained to you, right? You can always say that, yes, the nurse noticed this and I noticed the same. And I wanted to bring it to your attention before they could bring it to the consultant's attention. And if this is happening, it's important for us to know, important for you to know and stop. Right, so that there is no patient care that is being endangered. Yeah, does that answer the question?
Sure,
Yes,
sure.
Dr.
Thank you.
Absolutely. So, Dr. Sultan, go ahead. You have a question.
Yes, I want to ask, like, if a colleague is saying that he's depressed because of the breakup and that's why he's taking alcohol, so do we have to provide the support to the patient, to the colleague?
Yeah, there are support that is available. Right, that support can be availed through the educational supervisor or the clinical supervisor. So you can always tell them that you can always avail further support and help through the educational supervisor, even though that might have been the trigger for causing him to do what he is doing, right? But that's not a behavior that you should that is acceptable amongst the practice members, right? Amongst the practice itself. So you have to bring that forward. Like, I'm so sorry that you are going through this, but unfortunately, even though you have been experiencing such a hard time, you cannot be coming to work under the influence, because that is what's going to, cause a problem. Your behavior under influence can actually pose a serious risk to the patients that you are seeing. And this goes against our medical ethics, right? But you always reach out to your education supervisor who can help you seek further help, for your good.
Okay, thank you.
Yeah. So awesome. So from your point of view, you're going to tell him all the help that he can avail and prevent him from causing any more harm, right? So that's a conversation that you ought to be having, right? I hope that clears it out, everybody.
To practice this case with AI, please visit TuringMedSchool.com.